My mom and dad bought this farm in 1963. From the time I was old enough to get out of the house, I always loved the farm, being outside in the barns. Go to the feed mill, ride on the tractor. It's the only thing I ever wanted to do was farm. Never did really know something was wrong as far as symptoms or how I felt. What got us started on this journey was I was losing weight, and I wasn't trying to lose weight. So I went to the doctor, had blood work, sent me for a CAT scan, and that's when they found something they didn't like in the looks of the bladder. So I went to a urologist. Cancer is a scary word. My urologist referred me to Dr. Bain at Dayton Physicians, and very personable, very knowledgeable, and the treatment he recommended.
And so bladder cancer can be challenging. Oftentimes it requires a multidisciplinary approach. So unlike some other cancers where perhaps just surgery or just chemotherapy may be sufficient, his requires a combined modality treatment.
Dr. Bain recommended Dr. Pohar at the James, so we visited with him a few times. Had the surgery scheduled to remove my bladder.
So, this partnership allowed us to have that degree of conversation and come to a consensus of the options that he had available. What was I thinking as a surgeon? What was he thinking as the medical oncologist? How could we synergize that discussion? So I think that certainly allowed us to bring our James thought process, to the conversation.
So that collaboration between Dayton Physicians and Ohio State that offers people the opportunity to get a portion of their treatment at home, but then also have access to the highly specialized or very technical component of the surgical intervention is, I think, a great component of the relationship that we share with OSU.
If somebody would have a similar situation as I have had, I would definitely highly recommend both the Dayton Physicians and the James at Ohio State.
There's nothing better than seeing Mr. Keller go back to enjoying his family, enjoying his vocation. There's nothing more rewarding than that.
It's a little different lifestyle now, but I feel good. I'm able to do everything I want to do, so I'm going to have that new lease on life to enjoy my family, my grandkids, and so I'm doing really well.